Hi, everyone, and welcome to our Connected Kinesiologist meetup for Monday, May 31st, 2021. This evening, we have a special guest with us who is Alice Bonsignore. I think I said your last name correctly. Sorry, I forgot to ask you about that before we went on air. So Alice is a registered kinesiologist. She has over 11 years of experience in research and clinical experience as well in cardiac rehab. Alice completed her master's degree in the Department of Experimental Medicine from the University of British Columbia and is currently completing her PhD. She tells me she will be finished in about 3 weeks, which is super exciting. Congratulations early on that. And she is doing that at the University of Toronto. The focus of her research program examined the physiological changes occurring in both blood vessels and the heart secondary to cancer therapies. So that's why Christiane is very interested in this area too. And these cancer survivors should be referred to cardiac rehab in order to reduce their risk of heart disease, one of the leading causes of death in this population. Alice is currently the program director for the Healthy Hearts Cardiac Rehabilitation program in Goderich, Ontario, and she has a growing interest in how to improve cardiac rehabilitation delivery models to reach high-risk and vulnerable populations living with heart disease. In addition to this, Alice has experience in teaching and supervising students at the undergraduate and graduate level and hopes to inspire as well as support more kinesiologists interested in the field of cardiac rehabilitation. So welcome, Alice. My background as a kin, I've been doing clinical practice for about 30 years. And in 2007, we started First Line Education, which is a continuing education company aiming to upskill kinesiologists to make sure they are happy and stay in professional practice so we can build our field. And we've been hosting the Connected Kins meetups for just over a year. So we're really happy to be finding more guests. If anyone has any other guests to suggest, I'm definitely open to that. And I'd like to pass this on so that we can hear a little bit about the backgrounds of each of the other people here as well, just to help to enhance our networking. So Zana, would you like to introduce yourself?
Absolutely. My name's Zana. I'm a registered kinesiologist in Windsor, Ontario. I've been a kinesiologist for about 2 years. I currently work in occupational rehab. However, with the pandemic, we've started seeing a lot of COVID rehab, which I believe is similar in some ways to cardiac rehab.
Okay, Annika, would you like to say hello?
Okay. Hi, I'm Annika. I'm currently a high school student at Rosedale Heights. I'm actually doing a co-op with Angela for a course. I'm actually going to study kinesiology at York University next year, so I'm very excited about that.
Excellent, excellent. Thanks very much. Christiane.
So I'm a kinesiologist, been practicing for about 4 years. I did the Master's of Professional Kin at U of T. And currently I'm working in a rural town, basically do a bit of everything from long-term care to acute to outpatient. And I'm hoping to start some sort of cardiac rehab and or cancer rehab up here.
Nice, nice. And whereabouts are you again?
Near Greenstone, Ontario.
Which, can you give us some?
About 14-hour drive north of Toronto. Or 3 hours from Thunder Bay.
There you go. Okay. Next we have Gemini.
You said my name, right?
I did.
Oh, sorry. Yeah, so I am actually a recent graduate of the BSc of Kinesiology at York University. Yeah, so that's exciting. This is after this is following a career change of mine because I originally did a BA in English and French, and I've been teaching, and I've been doing a lot of like work as a grad admin at U of T. So now I'm just kind of trying to go into more health promotion. So ultimately, I plan to do my registered kin exam, and hopefully we'll get into like, I'm interested in chronic rehab or chronic disease rehab and all that. So yeah, I'm super excited to find this group.
Oh, great.
Yeah, to help me along the way.
Welcome, welcome. Annika, you may have some conversations there with Gemini. Catherine, hello.
Hi. So I graduated about a year ago from Western with my BSc in Kin, and I wrote the exam in September. So I've been working for around 8 months as a registered Kin at a small physiotherapy clinic in Sarnia, where I help out with the GLAD program and other patient care, and also at the front desk. So
Nice, nice. You landed on your feet quite solidly, my friend. That's great. Emma, how are you? Can you introduce yourself and say hello?
I'm good. I graduated kinesiology in 2018. I decided that I wanted to write my exam last summer, but I waited until the April exam, and now I'm just waiting to write it since that one was postponed. So I'm not sure if they're doing September or sometime in the summer. They haven't said anything yet, but so right now I've just been looking for a position for the summer for something like within the physical activity for seniors space.
Nice. Very good. Very good. Well, thanks, everyone. It's good to have a bit of background about everybody here, and Alice will be able to speak to each of you about your interests, I'm sure, as we go through our chat this evening. So Alice, maybe the first place to start would be, what interested you in kinesiology in the first place?
I came out of high school and the only thing I was really passionate about was playing sports. So I think that's like most of us. And I actually did fitness and health promotions first. So I thought that was actually a pretty cool route to go because I got a lot of clinical sort of hands-on experience before transitioning into my degree. But that was really kind of where I started. And then as I got into kinesiology, I can speak to why I chose cardiac rehab, but right out the gates, I just knew physical activity was kind of my passion and what I envisioned myself doing.
It's so interesting that so many of us come into kinesiology from that sports side, and then we realize how big kinesiology is and think, oh my gosh. And so many of us work in that chronic autoimmune disorders area, and particularly with older adults. It seems to be a real huge niche. And as you can see, anywhere from cardiac rehab, cancer rehab, osteoporosis, arthritis, diabetes, there's so many areas within even that smaller population niche that you can then further specialize in. So it's really interesting. To follow up to that, why a master's degree? And talk about why you decided to go on further.
Yeah, so so because I went to Guelph Humber, we had a lot of placements. So I was super lucky, I think, because of that. It got me into cardiac rehab. So Toronto Rehab in Guelph Humber didn't have like an affiliation or anything like that. And I was like, I want to work at Toronto Rehab. So we created it. And so I did my first placement, 180 hours, sort of working in the cardiac rehab program. And then they hired me on actually as an exercise leader, which I thought was super fortunate to not be out of my degree, but I had the fitness and health diploma finished. So I think that's why I was able to get the job. But then my second placement, I did a research paper with Dr. O. So we ended up actually publishing it.
Wow.
Yeah, it was really, kind of cool. First paper ever in the field of cardio-oncology is what it's called, kind of blowing up now, but looking at cancer survivors who have heart failure secondary to their treatments.
Mhm.
So we did a retrospective study of that. And it just sort of, I don't know, I thought I wanted to get into teaching originally. So everyone's like, you have to do a PhD. So then I applied to Darren Warburton's lab because UBC was always a dream of mine. And that's how I ended up in experimental medicine, because that's where he supervised. So I went on, and that's kind of why I did it. It was sort of like I was given an opportunity that I think many of us would be very appreciative to have. So I couldn't say no, really.
Great. Fantastic. So Dr. Paul O is the director of the Toronto Rehab Cardiac Rehab program, and he's since added a diabetes rehab program to that, I believe.
Yeah, that actually existed even when I was working as an exercise leader back in 2010, 2011.
Oh, good.
So cancer rehab, diabetes, and heart failure and cardiac all exist at Toronto Rehab.
Wow. And of course, we all know about how all those fit together, and of course, how further study is going to be super important so that we can eventually start to mitigate some of the risk factors, hopefully, from all of those things coming together. So your work is super important. This is great.
Yeah. So yeah, that's why I chose the master's. Was interested in potentially teaching, and I just thought it would open some doors for that.
Oh, great. So did you do any teaching then with your master's degree and or as you were going through your master's at UBC, or did that come later when you moved into U of T?
U of T is really where I started doing the TA work. But working within cardiac rehab, you do a lot of adult education. And that's sort of, I think, where that came from, is I really enjoyed teaching. So not teaching, students, but I was teaching adults. So in that sense, I did teaching. I was working all through my master's, so I was working in cardiac rehab as well. So I've always sort of had that synergy between the two.
So that's great. So you actually worked through your undergrad, had great exposure to real clients in your undergrad.
Yeah.
Into the master's, into the PhD. And I think your niche has probably narrowed as you've gone through each of those academic journeys. Is that right? Got a bit more specific?
I kind of say the only thing I know in life is cardiac rehab.
Just a lot about it.
Yeah, it's like all I've done. Like I did have a 2-year stint with the executive health program at Cleveland Clinic.
Oh, cool.
But for the most part, no, I've always been in cardiac rehab. And I think many students will appreciate that, school costs money. So for me, I had to work. And in a way, it was sort of nice because I've always had a job in school. And I think that that's what sort of shaped what I've decided to do. It also gave me experience when I came out. So that's been really, really good.
Oh, that's really good. And how did you know who to follow? How did you know what master's and PhD programs were on your radar? How do you sort that out if someone was interested in doing more schooling after their undergrad?
That's a good question. You need to seek out opportunities. Like I still in my PhD was volunteering. And I think that that's probably one of my biggest messages is get out there, volunteer. You're never too experienced to volunteer. You have to sometimes put in some extra work, but in the long run, it will play out for you. But yeah, I just picked something and I said, I want this. And I went for it and I pushed for it. So I would say that would be like my biggest advice for that. In terms of like knowing how to navigate, it was choosing Toronto Rehab, saying this is what I want, going for it. And then obviously working with Dr. O, he's a great mentor to ask. Like you said, he's a medical director. So asking him like, where do I go from here? And then I just know Darren's work actually from who was my master supervisor. I know his work from a lecture in undergrad, and they showed a graph of how physical activity was a greater risk factor for cardiac mortality than than smoking. So I looked up the paper and I was like, oh, he's at UBC. UBC is a dream school. Let me try for this. And I applied and I flew to BC. So I made my presence known.
I'm here and I want in your program.
Yeah. So that's how I got in. But yeah, really starting, if you didn't get the chance to start in your undergrad, try and get in with people even after your undergrad and start volunteering. Like if a student wants to come to my program and want to volunteer with me, I've set them up with jobs in Vancouver, so to speak. But yeah, you just got to get in the door.
That's great.
Mm-hmm.
Thank you for that. I am going to run and grab my charger so that this meeting can continue. Does anyone have any questions for Alice that they could ask while I run and return? Maybe there's something you'd like to know about her cardiac rehab experience, or any information you might like for perhaps starting a program on your own.
I think you said the question.
I'll be right back.
How would you recommend getting a cardiac program kind of off the ground?
Yeah, great question. Because I was going to actually probably speak to some points with us both being in rural. I know the Thunder Bay area. You said Thunder Bay or North Bay? Thunder Bay? Yeah, okay. So I know the area quite well. So how would I get it started? Healthy Hearts is sort of an interesting little bubble that I live in. So Healthy Hearts is in Goderich, Ontario, which is also rural. Our town itself has 8,000 people, but the program services sort of the surrounding communities that make up about 100,000 people. And the 8,000 people in Goderich is the biggest town. So I think you can probably relate to that in terms of being in a rural environment. And they started Healthy Hearts as a charity. So Healthy Hearts has no government funding. We have no hospital funding. We have no LIN funding. We have no family health team funding. So they got a charitable sort of designation, and it is a fee for service. So the patients do pay $50 a month, but that does get them 8 sessions supervised by myself, as well as medical supervision from a family doctor in town. And we do fundraising, we do donations, and that's really actually how we started. And we've been around for 26 years. So I think it speaks to the fact that we're able to create programs, even maybe without some of this external funding. And I think in the rural communities, I think it would be a really smart move to try and do something like that in another area, because it has worked. The one thing I will add to that, though, is our program, the patients never graduate. So it's like they're joining a gym. So that's what really actually sustains our funding. They don't just leave after 3 months, but some of our members have been with us for like 20 years. So I do recommend that if you decided to go that route. The only other way you could do it is if you can link in with a family health team or a hospital that will magically give you funds.
Well, I'm actually in a hospital.
Oh,
so the rehab clinic is actually in the hospital. We're basically the only rehab facility. I honestly, I think the closest thing is Thunder Bay.
So would they give you, who would pay for like kinesiologists to run it? Will the hospital pay for that?
Yeah, most likely. Yeah, it would be through the hospital.
Okay. So if you have funding, I would say we can reach out, especially maybe offline, and I can teach you how to start a program, give you some resources, that kind of stuff for sure. If you're trying to get it off the ground, not a lot of experience, do exactly this, reach out to the network. Because cardiac rehab is really small. We're really happy to help you. So yeah, we can definitely talk more offline.
For sure.
Mm-hmm.
Networking is working. Isn't that great? We always joke that your network is your net worth. So making those connections is super important. So this idea of a charity is very interesting because it's a certain tax treatment that's very, very different, a business structure that's very, very different from what we may be typically used to, which would be kind of a for-profit company or corporation or partnership in some way. So I worked for a short time with a breast cancer program running out of many different sites in Ontario, and it was funded by corporations from a large part, and from donations. So other ways of looking at funding would be to approach different companies and different other organizations that could be able to contribute as well. So even though you do have a funding source, you could augment that with other groups that may be very interested.
Yeah, because the participants don't pay for 100% of the program. Unfortunately, that would just cost them too much money. And we know that sick people don't necessarily always have the resources, and you don't want to deny people care because of that, right? So we do rely heavily on fundraising and donations. Like there's some big companies in town that will approach every couple of years and hope they help us out.
Great. Yeah. That's really great. And I also think that, I mean, the $50 a month you said was a membership fee. Look at this, people are members for 20 years, over 20 years. So when there's value in something, people will pay for it. And then possibly having a sliding scale where people do pay a membership fee based on their ability to pay too, could be another feature.
Yeah, we do that. I do find it interesting though, how if you look at the sessions, it's 8 sessions a month supervised by myself or one of my other staff. And it's really unfortunate that there's still that's something that deters people from being able to invest.
Right.
You know, if you look at like a physio model or a kinesiology model where it's like $70 a session or something like that, we're looking at like $8 a session, and it's still not something that everybody grabs onto.
Wow.
So getting that like knowledge out there is super important, because I always get, well, what do I need this for? Right? I would say 70% of the people I call, that's what they say. Or my doctor didn't say I need this, so they don't come.
That's pretty interesting. So having an interesting way of selling your services that are really clear, and sometimes it's bringing out the scary facts to say, here's the reality. Here's what the research says about what's happening with your body as you move through a cancer journey, or as you move through diabetes, or as you move through congestive heart failure. This is what's happening, and here are the ways in which you can help to maintain your health and possibly even improve your health with supervision and counseling about exercise and nutrition and sleep and other factors that we know will maximize the physiology of the body. So that would be really ideal to be able to pull together all that information in that sort of membership model. But it's surprising that it's a hard sell even with assisted financing.
And that is actually what our program is. So Toronto Rehab gave us their education, or they've gifted it to us, or they'll do it for any program I think that really reaches out to them. But we cover all of that. We cover nutrition, sleep, stress management, and exercise. But yeah, people, you can't teach an old dog new tricks. Right?
Have you spoken to like your regular like clients and tried to get like their perspective as to like why they come? Because I'm just curious in terms of like gain frame versus loss frame messaging. Maybe cancer patients react better to gain frame messages.
So I'm actually the intake coordinator as well. So I'm the one that calls everyone. So yeah, like what I kind of just framed is what I hear from them. But yeah, I think it would be great to even get some feedback from some of you guys about, you know, how do you sell? And I'd hire you for your sell there. That was great. But yeah, I definitely think in the delivery of the message is super important.
I think that's, to be really simplistic about it, teaching people about this is what the research shows. And this isn't the media, this isn't what you might find through watching television shows that kind of glorify health and wellness and sickness and long-term disability. This isn't social media where you're getting articles from dubious sources. This is properly conducted research that from very, very credible sources that clearly point to what's happening with your physiology.
Mm-hmm.
And here are the ways that are proven to start to repair those systems. And we know that the body is super adaptable. And for a lot of clients with really challenging health conditions, I often talk about just finding the loose thread that you can tug on a little bit. So is it in nutrition? Is it in sleep? Is it in breathing? Is it in anxiety and stress management? Is it in physical health? Where is it that you can get in so that you can start to work on a particular area of interest for a client?
Mm-hmm. And I would say once I get them in the door, I'm very successful at that part. It's just getting them through the door when it's, you know, a cold call. They've never heard of you. They didn't tell you at discharge that that I'd be calling. So a lot of them are like, what is cardiac rehab? You know, you're starting at the very basics.
Wow.
And you get a lot of, well, let me check with my doctor first, but then they never loop in with their doctor and they kind of get lost in the system. So it is a challenge, definitely, but I really welcome any feedback on how we can maybe work on getting more people through the door, for sure. I always use the analogy of like, when you go for a knee replacement or a hip replacement, they'll send you to physio. Cardiac rehab is the same, but it's for your heart. So you've had a heart attack, standard of care is now that you're sent for rehabilitation. That's what I'm doing, and that's why I'm calling.
Mm-hmm. Yeah, that would be impactful. Does anyone have any other sales tips for Alice?
I know when I was looking into things, I would ask the community seniors, I was like, where do you go if you had a problem? Who would you go to? And pretty much all of them were like, my doctor. I will go to my doctor. So I'm just wondering, is there a way to reach out to the doctors in the area? Like, is there a way to find out like who these patients, their doctors, and try to talk to the doctors and then practically have the doctors do your advertising for you?
Yeah, so the doctors are really engaged in town, so we definitely have their support. I find the challenge is that cardiac rehab referral actually happens at discharge from the hospital. So they're doing so much in that period of time, like getting them optimized on their meds, and like they're giving them so much information. There's a lot of anxiety often for patients around that time, that they just, for whatever reason, whoever sees them doesn't give them the message about cardiac rehab. And it's really, really hard to sort of get in there and change practice and do it politically correct without stepping on toes. And, you know, healthcare is so stretched, you already know. But absolutely, more advocacy, more getting in people's ears is definitely important.
Do you think maybe you could like, I'm just off the top of my head, I'm just thinking for people who are going through cancer rehab, is there any way you can create like a checklist and be like, hey, here's the information that you're going to go through, and then just like at the bottom be like, PS, be sure to check out, you know, Healthy Hearts or something.
So do it, I think this is my understanding, is they do it sort of in the back office of like, okay, patient's discharged and they do all of this, and part of it is, yes, send to cardiac rehab. So the referral happens, but the message to the patient doesn't always happen. And that's just where I am. It doesn't mean that that's the case everywhere. But when you really get into working in healthcare and you start talking to a lot of different physicians and people in all different positions, like rehab is not really on everyone's scope, unfortunately, right? We live in this world where we know all of the research and we advocate for it all the time, but I don't really feel like the message is out there necessarily to everyone else in terms of like what we can really do for patients.
You've tried attending kind of the lunch and learns with the physicians. Maybe you mentioned that already, where you meet with them on a monthly basis to chat with them about your program.
Yeah. I don't think it's the awareness. It's just the
Follow through.
the step. Yeah, like we need
Right.
to hone in on that and get more buy-in. And it depends on the physician too, right? If it's the physician that attended your lunch and learn and they do the discharge, then yes, like the message is given. But if they don't attend the lunch and learn, then the message never gets to them and it never changes the way that things are done.
Right, right. I wonder if you could connect with surgeons even and send them a poster that they could, or family physicians and surgeons, that they could email their patients directly. I wonder if there's even a way of flagging a diagnostic code to say next step in your plan of care would be to send this poster, to this alert to your patient.
So they do that, like they'll give information, but it's still that like physician endorsement, right? They'll be like, oh yeah, I got this like paper when I like left the hospital, but let me go back and check with my doctor if I really need it. There's like that. We like when you're trying to get people to change behaviors, we know education is the first step, but then there needs to be steps to actually make things happen. I don't know, it's a complex sort of thing to sort of work through, but you know, I know like Sherry Grace, I worked with her at University of Toronto, UHN, and like she did a lot of work around like just automatic referral and how it increases uptake into cardiac rehab by like sevenfold. Wow. I don't know the exact stat on that, but I know it's something like in that realm. So we've done that, but like, how do we make it even better? Right. I guess is the next step.
Are you able to offer to the client, with their permission, phoning their family physician? Would you like me to phone your family physician to give them a little bit of background about my program? Would that be helpful for you?
If you could ever get a hold of the physician is what I would say about that. And also, I think if you're in like a bigger center, it's a bit different. So being in a rural center, like I'm the intake coordinator, I'm the program director, I'm the fundraiser, I'm the case manager. I do everything.
All trades,
right? Yeah. So like even just sending the letters of like, yes, they're attending or no, they're not attending is, you know, it's time consuming. So to pick up the phone and chase down doctors and tell them about cardiac rehab, I just don't see it being like super efficient. Yeah, I don't know.
Opportunity for a co-op student or 3?
Yeah, that's a good idea. I can put some students on that.
I think that would be valuable for the co-op student as well, because they would understand their place in recruitment and retention of clients to build a program. And it would give them practice talking to the gatekeepers, the receptionists, and you know, ideally the physicians, if they were lucky enough to grab them. But that might be helpful, is to say, I'm a student calling on behalf of. And I'm, you know, it kind of puts them in a position where they're not the director of the program. They are in the student experience, and, you know, can you help me out? I'm trying to encourage your patients to move into this program after their hospital stay.
Yeah, I think that's a wonderful idea. Because sometimes as the program director, when you call, you, like you said, you don't want to come in strong, like, why aren't you sending your patients? Right? You have to be careful with that too. So I like the idea of the students. I think that's a wonderful idea, because it's a little bit more of a nurturing, I guess, approach, I would say. Yeah, I think that's a really good idea.
And then you can empower the co-op students, because you've educated them about all the reasons why, all the selling points about why, and they've got nothing to lose. So they can just keep going from one point to the next and say, so when can I confirm that this patient will, or the physician will be getting in touch with this patient to confirm attendance? And it's, you know, I've been told this is what I have to do by the program director. So, you know, throw me a bone here.
No, I think that's a great idea.
Otherwise, I think, can you use testimonials from current patients to say, this is really a great program and I was hesitant to join up, but now I've joined up and I've been with them for 20 odd years, and I now have a community of people that can support me in my journey and help me maintain really good habits.
Yeah, I like that. I could have put up like a testimony page sort of, and if someone's like sort of on the fence about coming, I can say, well, check out our website and see some testimonies. Maybe that'll encourage some people. Yeah, I think that's great.
That could possibly work. Did you have any ideas, Christiane?
Oh no, I was just thinking even like a YouTube channel or something. Because especially if you've got like 20 years worth of patients, you know, it's like, hey, like, you want to come in, give like a 2-minute video,
Yeah,
you know, for like YouTube, and be like, because I really do think that community is really big. I have one patient who she's a dragon boater, breast cancer survivor, so she's a dragon boater, and she was just saying like it's so nice to be around other people who have gone through that journey.
Mm-hmm.
And it's very hard for like cancer patients to relate to people who have not been through it.
Mm-hmm.
So like that could be a huge selling point. Like the whole, you know, it's good for your heart and it's good for your health almost becomes a side point. But it's just like, hey, come here and we have this community and we're gonna teach you, you know, and I don't know, maybe that could help.
Mm-hmm. Mm-hmm. One point for the thought is the people that don't come to cardiac rehab are like in research and then sort of in my own experience, it is the people that are frail, maybe not great health literacy, people that are older, multiple comorbidities. And I just find a lot of like accessing a YouTube channel isn't something they can do, right? So it's like, how do we, the people that I get to come to cardiac rehab, I think are some of these ideas that we're coming up with. Those are the people that we already get to come. But how do we start reaching these people that like don't have internet access or living in rural communities? Like they can't check the internet or check a YouTube thing, or they won't even really understand what they're looking at. That's really my interest. Like, how do we get those people through the door? And like, even if the doctor talks about it in the hospital, they're discharged. The patients can have cognitive impairment because they have CAD. So how do you close that sort of loop and get them in? I've had this weird, crazy idea of why don't we start tapping into people's like home, like TV stations? You know how there's like, I don't know, in Niagara where I grew up, there's like Cogeco TV.
Yeah.
Get on there and be like, tell them on TV. It brings me back to this study that they did at Toronto Rehab where they looked at patients in Brazil. And I don't remember the study exactly, but I remember the presentation. And it was like, they didn't care what the doctor said, they cared about what the TV said.
Yeah, every day.
Yeah. So I don't know. I think these things will change in the next like 10 to 15 years when the people that are getting older are sick and then technology is a little bit more accessible. But right now, if you look at cardiac rehab, it's not really the population that you always get. So
it's too bad that, one thought would be that you get a short spot abutting a very popular newscast.
Yeah.
That, you could give a cardiac rehab tip of the day or something like that. For more information, give this number a call, and here's what will happen. 15 seconds would work. Or the other option, wouldn't it be amazing if you could solve the internet issue once and for all, and then send each patient home with like a Chromebook, something very simple where they press a button and they can log in to a rehab program. So wouldn't it be neat to connect with corporations who could fund the purchase of something very simple where it was one button to meet and greet a group daily, and they could participate at home, even in a seated program where you knew they were hitting these criteria, they were safe, and move through a checklist to make sure their environment was conducive to the exercise and education, and then off they go. And then they could access videos that were pre-uploaded into a device, and they could work their way through information.
Yeah, I think you hit something really important. Is I think that the model of cardiac rehab as it is right now doesn't service everyone. I think there's a huge market for kinesiologists in this. We know only 30% of people who are referred to cardiac rehab actually go. So what are we doing with the other 70%? I think you should start a kinesiology business and start taking them in. Offer flexible times, offer different modes of delivery. And I think we can get more people active, for sure.
It's a great idea, because if you can reassure people that they will be safe, if you could get the stamp of approval from their family physicians and their cardiac surgeon, then all you need to do is just deliver an easy access point for them, where you're handing them a community, access to a community, and the rest takes care of itself once they get through the hurdle of reassurance that this is okay, and in fact this is really beneficial. And then secondarily to that, here's your portal to a community that will support you every day.
And then they're connected already in the community. That's something I think about a lot. Like if I was sick, and you can think about, kind of reflect on yourself for this, it's like, if I was sick, do I want to go back to the hospital for rehab? Right? Some people will say yes because their physician supervised and they feel safe. And I do think hospital-based rehab in that first like acute phase 100% has its role. But if you're thinking about like long-term success, long-term health changes and sustainability, I think we need more community-based rehab. And right now, cardiac rehab doesn't really exist like that. It's mostly in the hospitals and family health teams, and then they graduate, and then where do they go?
Wouldn't it be great if insurance companies would fund participation in programs, and it wouldn't matter necessarily who the provider was? That would be taken care of. You wouldn't be part of the program unless you were qualified, but an insurer would cover cardiac rehab, post-surgical hip and knee replacement care, diabetes care, and then it would be up to the provider to assemble their own team. And perhaps you would report into the insurer about the status of their insured to make sure that their policy would continue to pay. So there was accountability from the patient or the insured and the treatment team to say, you know, the insured is coming to the table and participating, and these are the results being shown. And then on the other side, here's how the program is delivering the services. And generally, here's how the program is really performing. So it's coming from two different parts. And then the insurer says, well, yes, this person is improving. So the team is helping that person stay at work or return to work following surgery or following a particular event. But that would flip the private insurance groups on their head, because now you're looking at systems and programs versus individual providers, which is where, as you know, KINs are struggling right now. How do we access these programs?
Yes.
These insurance programs, and we simply can't yet at this point in time.
Yeah, which I just think is crazy. Like, we could do so much for so many people if that was the case. Yeah. So that's a whole other topic that we've talked about many times. Does anyone else have any questions about particular clients that they may want to ask about, or programs that they may be involved in or interested in accessing? Perhaps that's a direction you'd like your career to go in. Or maybe what I do on a daily basis.
There we go. Yeah, let's talk about that. What does your typical day look like?
Well, in my week, I teach 20 hours a week, and then I have 15 hours for admin. I think it's a little bit different at bigger centers, but that's how it is where I am. My admin is mainly, in terms of just the patients, not as the program director. It's like note taking on your patients and following up with them if they have questions, or people call you or email you if stuff comes up. So I'm following up with them. But what I find really interesting when I bring students in that they don't really know in the beginning is how complex cardiac patients are. So I laugh at the who's sick of hearing case studies in school? My students complain about it all the time. They want to see real data. But they're not cardiovascular disease, diabetes, and OA. Like, that's just not a thing. You open up their chart and they're on like 5 different medications, like just from the cardiac standpoint. They have an arrhythmia, they have GERD, I don't know, they've had costochondritis, like all of these things that can also cause chest discomfort, as an example. But then they also have depression. And when they exercise, they also get preventricular contractions. So like, how do you program around that? How do you deal with that? So that's what a general cardiac patient looks like. They are not just this, they have CAD, we make a target heart rate and then we exercise them and you adjust it because they're on a beta blocker, which is where I think you need to get in the clinic and you really have to see the patients. When I have any students start with me, I give them charts and I say, start reading.
Yes.
Because honestly, I learned cardiac rehab through volunteering, and I basically explain it as like through osmosis.
Mm-hmm.
You just have to get in there. Until you volunteer and until you're doing that, it's really, really a hard thing to learn.
A couple things there that I'd like to comment on. The first one is how complex our clients can be. And I think that's why kinesiology is very important. It's a group of people that isn't in a personal training scope of practice. It's not particularly in a physiotherapy, chiropractic, massage therapy scope of practice, osteopathy scope of practice. It really is a beautiful area for kinesiologists to excel in. And then the second thing I wanted to mention was that the critical thinking piece is something that's very challenging to learn at school. So being able to read through a client chart lets you watch a clinician make some decisions and start to shift a treatment program around on a daily basis. So here's how they presented today, which is not how they presented yesterday or the day before that. So where do you start and how might you progress or not progress your program on any given day?
Mm-hmm. What really actually helped me, and advice that I often give to people, is if you want to get into cardiac rehab, doing a master's taught me how to read research. Like, obviously a PhD has accelerated that, but understanding how to read a research paper when you don't know the answer has given me a lot of confidence in being able to treat my patients. So when I don't know something, like an example is, say someone has it's something called aortic stenosis. So it can be a contraindication to exercise or to do a stress test. So that's like, if you look at some of the guideline papers, that's what it says. But then I went to the research and I said, okay, well, in 2020, there was this paper that actually is sort of shifting that thought. So I really pushed the doctors and I said, let's get this patient in. This is not a contraindication. We can test this patient. But it's because I know how to do research that I was able to do that. And also have the confidence to tell doctors what to do. So I would say, like, if you're kind of, wondering what you should do, I do think that a master's is valuable in that sense. Obviously, someone like yourself, if you have tons of experience, you might not need to do that. But if you're fresh out of school and looking for those like analytical thinking skills, I definitely think that that's worth it.
Mm-hmm. Mm-hmm. Just to follow up on that, and Gemini, I see you. So 1 second here, we'll get to your question for sure. That's one of the things that we are hoping to do in our first line courses. We just brought on board Rebecca Adaman, who is our co-admin in the Connected Kinesiologist group. Her specialty is knowledge translation, and her specialty is knowledge translation for kinesiologists. So what we're hoping to do is teach people in each of our courses how to take the current research around that particular topic and assimilate it through the theory into their practice, because I think that's what's going to help kins become real critical thinkers. And also, as you mentioned, to then go back to our team members to say, hey, let me show you about this new development. And clinical practice guidelines are updated every 5 years or so. There's a lot of research that occurs within that 5 years that I think we don't need to be waiting for a clinical practice guideline update that we could be bringing to the field much more quickly if we understand how to find and sift through and present that research.
Yes, absolutely.
Gemini, your question.
Yeah, I actually have two questions. I think I'll ask this. I think this is the simpler one. So I remember during my undergrad that I just finished, they were talking about there being a move towards having kinesiology and kinesiologists like more, I guess, established as like a healthcare profession, or like healthcare, like someone where you can go to for health knowledge, I guess. Do you, I guess this is for anyone, do you see this actually becoming a trend where like doctors kind of recommend kinesiologists, or like people are actually starting to take exercise as a prescription seriously?
I think we're getting there. I think we need to continue doing a really good job in advocating for ourselves. But I have noticed an upswing in salaries and positions, recognition for kinesiologists, especially in the last, I would say, even year. At least in cardiac rehab, I've noticed a big change. And I know we were talking earlier, like I'm sort of trying to get myself more into government as a kinesiologist to really help move these things forward. But the fact that they're even considering me as a kinesiologist for a position like that, I think speaks to the fact that we do have a lot of skills that are valuable. So to answer your question, yes, I think that the wave is starting to come and we need to keep on it. And I think in the next 5 years, kinesiology is going to be in a completely different place than it is today, for sure, in terms of us being more integrated into healthcare teams and systems.
There's a soundbite I'm pulling out. I see it coming. I see it coming. We're taking on bigger roles. We're taking on roles with bigger multidisciplinary teams. And we are occupying niches that no other healthcare provider typically would occupy. And I think showcasing our unique skills in that sense is how we're going to be able to get ourselves ahead.
Mm-hmm.
So yeah, it's coming.
You had a follow-up?
That's exciting.
Yes. Yes.
Yeah, sorry for interrupting.
No.
Yeah, I think that's exciting just because, you know, you never see exercise as a prescription that much, like in a healthcare sense. Well, I'm speaking from experience with my grandma and all of her health issues. So yeah, I'm glad. My second question is kind of unrelated, but like as a person who wants to go into more chronic illness rehab as a career, what are some kind of like institutions or places you would recommend volunteering? Because like, you know, you see a lot of physiotherapy assistant jobs, but it's not, I don't know how, if there's somewhere else I could be looking.
Yeah, so to speak to your first comment, kinesiologists, we can also do more than exercise, right? So we're health promoters, we can translate knowledge, there's lots of things that we can do. And that's where I think that we're going to start growing into these other roles. But then to follow up on the question, so I just hired some new staff. And I think you're trying to get at like, how do I kind of break into the chronic disease world, so to speak? And something that I looked for, because I know in a rural community, I'm probably not going to get people with cardiac rehab experience, is people with case management experience. So whether it's starting your own practice or if you've worked in a physio clinic and you've done case management on patients, that makes a massive difference if I'm going to hire you or not, because I know that you can take a patient, you can critically look at them, you can document on them, you can follow them through a program. So they don't have to be a cardiac patient for you to gain those skills. In terms of, but then for chronic disease, like I just talked about how complicated these patients are, you do need to get in front of cardiac patients to really know what to do with them. So depending on where you live, like obviously being in Toronto Rehab would be kind of the place to go. They take in a lot of students. Did you say you were at York?
Yeah, I just graduated from York.
Okay, so did you have Sherry Grace as a professor?
No, I didn't.
No? Okay, so she's at York. She's a name you could reach out to.
Okay.
I'm just thinking off the top of my head who I know over there. Like Toronto Rehab would be where I would start if you're in Toronto. They take in lots of volunteers, lots of students. You'd have to go through like their volunteer sort of process and like paperwork and stuff like that. But once, I think things are probably on hold right now because of COVID.
Yeah.
You could try that. The other thing you could try is volunteering for like research studies. So even though it's not, because you can work on a research study that's working with cardiac patients, and then that's how you would get the experience. So you could try that.
Oh, that's cool. I never thought of that.
Working
Yeah.
as a research assistant, almost that kind of
Yeah.
role. Yeah.
Yeah. But maybe you do exercise prescription for cardiac patients for a research study for like 1.5 years or something like that. That's how I got my cancer experience, was as a research assistant.
Oh, interesting. Can you explain a little bit more about case management in case someone would like to know how to get more experience with case management?
Yeah, like, can you just take a load of patients? That's a skill you have to learn. Like I oversee a typical cardiac rehab staff member would oversee about 100 to 150 patients. So,
Wow.
yeah. So knowing how to, manage that intake and prescribe to all of them and, follow them through programs. That's sort of what I mean. Like there's even like these like LIN jobs like for the government where you could be like a case manager type person. And if you're at allied health professional, they would hire you. Not necessarily hire you, but you'd qualify for the job. So yeah, just having a caseload of people that you are responsible for, being able to communicate with them, professionally, politely, all of those things, those are skills you would develop. You'd obviously develop your time management with that many patients, but then also looking at a chart, prescribing the exercise, seeing them through the program, and then giving them the sort of baseline, mid, and maybe like post-programming feedback would all be skills that if you could build those would make you a really good case manager. And when you get into cardiac rehab, that's what you're doing, you're case managing.
Mm-hmm. Those skills are excellent management skills for anyone who's looking to move up in their organization or anyone who's looking to start their own practice. Being able to juggle that many people with that many conditions, with all kinds of different referral sources and all kinds of different people to report back to on behalf of all of those patients that you're overseeing. So yeah, that's an ideal role for someone who wants to move on. Well, that's great, everyone. We're pulling past 8 p.m. here, just past our hour mark, not to rush anyone, but to think about wrapping up. Does anyone else have any questions for Alice about either their own programs or any programs that they may be interested in starting, or volunteer opportunities or further education in the area of cardiac rehab? And of course, Alice is probably just fine with you reaching out to her if you have any questions about how to get started or looking for support tips for your program.
Yes, always happy to talk. I think we need to continue doing these things to keep our profession going and inspired.
Agreed. Agreed.
Don't leave. I promise you.
There's lots of opportunities. Well, thank you very much, Alice. I really appreciate your time this evening. Thanks for volunteering to talk with all of us. And we will post this recording in our YouTube channel so that you can return back to it in case there's any notes that you'd like to take or anything that kind of strikes you over the coming days. And you think, wait a minute, we talked about that on that Monday night thing. So it'll be there for you. Thanks, everyone. And if there's no last questions.
I will put my email.
Oh, wonderful. Thank you.
There you go. Okay.
That's great. Thanks so much. And I will post that together with our video so that we've got that for everyone.
Great.
Thank you very much. Have a great week and hope to see all of you next week. Bye for now.
Bye. Thank you.
Thanks a lot.
Did I do